you so much for having me.
All right. Okay, so hold on, Jennifer. So I'd just like to do a little introduction. Then then you can speak afterwards. All right. So our next speaker is Jennifer Kuhl. Jennifer works as a campaign and policy lead with the Canadian Association of Physicians for the Environment and as a project coordinator with the Global Climate and Health Alliance. She holds a Bachelor of Arts from the University of British Columbia and a Master's of Public Health from Johns Hopkins University. Jennifer Kuhl has nearly a decade of experience stewarding the growth of non-profit organizations. She has helped to launch Leadnow, a digital campaigning organization prioritizing climate and democracy. In addition, Jennifer worked with the BC Health Coalition in Vancouver, advocating for improved and expanded public health care for all, including undocumented people. She's also part of the Generation Climate Initiative. So make welcome with me to speak with us on addressing the health impact of climate change. Jennifer, please take it away. Thank you.
Thank you so much for having me. It's a real honor to be here with all of you. Can you see my slides all right?
Yes, please go ahead.
Wonderful. So I am going to give, thank you for that lovely introduction. I'm going to take just a moment and say a word about the Global Climate and Health Alliance, which is the organization where I spend most of my work time. We're very fortunate to have Get as a member of GCHA, and GCHA is an alliance of organizations, all of whom are working at the intersection of health and climate change. Some of those organizations are fully focused on that intersection. They're doctors and nurses who are advocating all of the time with their whole focus on health and climate change, and others are organizations like Get who are looking at health broadly, either as a national medical organization or an international nursing organization, but who understand that climate change will very much impact people's health. And in addition to those member organizations, GCHA also works with many partners. So formally through the WHO Civil Society Working Group on Climate Change and Health, a Latin American network, and an organization called the Health and Climate Network that is looking at bringing not only health people together, but people from transportation and agriculture and those other sectors that really interact with people's health as it comes to health and climate change. But all of the partners and members that we work with are united by a shared vision of an equitable and sustainable future for all. So with a goal to minimize the health impacts of climate change and maximize the health co-benefits. Because I think there is, as soon as you start to open up the space of exploring the connections between health and climate change, you sort of see these two sides of the coin. One, the very many health impacts that we know we will see, that we are already seeing, and at the same time, incredible potential for benefits as we both work to mitigate emissions. There is a huge opportunity to make people healthier. We know air pollution is responsible for millions of deaths in the way that it makes our lungs less healthy. And so as we reduce global emissions, there's a real chance to improve respiratory health. I wanted to start hopefully not covering too much of what the prof was going to cover, but a lot of what I know about the way that climate change is going to impact health on the African continent specifically came from this incredible event that we were able to host last year. It was a regional consultation on health and climate change. We held in collaboration with the WHO. GCHA hosted one in each of the WHO regions. And it was very, very powerful to hear from health workers and researchers from across the African continent about the health impacts they are already seeing. I'm sure many on this call will be familiar with them, but things that really that I remembered as being particularly powerful, as we heard from I think we had almost 200 participants during that consultation, were stories of communities and health centers that are already seeing people suffering from the consequences of extreme heat. Maybe it's not what you think about I'll take a brief detour. You might not think of extreme heat actually being something that we deal with here in Canada, where I'm from, but I this summer had the tragic opportunity to see firsthand the consequences of extreme heat on people's health when Vancouver had a terrible heat wave that killed 600 people. And I know that is the case in a much greater degree in places that are so much closer to the equator than Canada is. We also heard quite a bit from about drought in Malawi, Zimbabwe, Zambia, Uganda, and South Africa. A participant from Liberia noted that while there wasn't drought, communities were starting to see that wells and boreholes were drying up sooner than they would have been expected, and that was meaning that people were having to drink less clean sources of water, and that was leading to other types of disease, mostly like digestive and gastrointestinal illnesses. Participants also really highlighted the impacts of flooding and what that meant, both in terms of displacement of people, but also the destruction and inaccessibility of health infrastructure, where you had clinics that people couldn't get to clinics, or clinics were destroyed. There was also a real flag around shifting disease patterns. So the story that stayed with me was a health worker from Uganda who said, we never used to see malaria in the highlands. And now it's there in these communities who've never experienced it before. And that's really concerning. So hearing all of this from these incredible health professionals, we also heard really strong suggestions of solutions. So one of them being just increasing health sector awareness, the thing you're doing with this very presentation. Around the world, most doctors, nurses, frontline health professionals didn't learn about climate change in their education because it just wasn't a priority 10 and 15 years ago. So that's really seen as one key solution. Another one is, I'll go into this a little bit more, but preparing the health systems for the impacts of climate change. I think participants really highlighted the need to bring communities into the conversations and planning for resilience to climate change, and also really highlighted the need for international financial support. I could talk for a really long time about the way that I think climate financing and the way that those countries who are going to be most impacted by climate change did the least to contribute to it. And I think it's very evident that northern countries who have been polluting for a long time owe the rest of the world a lot of money. And I think this is my strong personal opinion. And I think that there are some interesting opportunities when we look at global climate financing to make the case that some of that financing should be going to strengthening the health sector and being ready for disaster response. And finally, I just wanted to note another thing that was flagged was there a real need for research on both the health impacts of climate change on the African continent, but also possible solutions. This is just two quick images from a paper that I was involved in with the WHO Civil Society Working Group. Overall, we found that out of all of the articles that have been focused on the health impacts of climate change or health and climate change in the last 10 years, a very small proportion of these focused on the African continent. And then of the total articles, so that's the first graph is the all articles by region. And so the blue bar on the left is articles that were focused on the African continent, and the number is only 128 out of about 2,000 total that we reviewed. And then, if you look at the specific set of research that was focused on solutions, which unfortunately was not a lot of the research, only 6 of those articles focused on the African continent. So there's a real, perhaps, I'm sure, again, unsurprisingly to members of this webinar, there's a real dearth of research on what are the best solutions for climate impacts on the African continent. Sorry, come on, there we go. I'm briefly going to talk about, so when we talk about addressing the health impacts of climate change, I think one major thing that GCHA has been involved in is global advocacy, trying to push wealthy polluting nations to reduce their emissions, and really making the case that it's very important to do that from a health perspective, that in order to protect health, we must stop emitting greenhouse gases into the atmosphere. And as I said at the beginning, that doing that will have could have huge health benefits. There's also the suggestion that really improving infrastructure, making cities safer so that people can get around not by cars, but by public transit or safely by bicycle. That all of that also has sort of the health benefits of keeping people active. So I think while it's not quite addressing the health impacts yet, one thing we are seeing health professionals around the world doing is stepping up and saying, we do need to act on climate change. This is impacting our work. We have just lived through the crisis of COVID-19. We do not want to be responding to the crises of climate change. We need climate action. And so that's one way we're sort of the health community is trying to get ahead of some of those impacts. And then in terms of ways we are, I'm seeing the health community broadly start to address some of the health impacts of climate change. There is a real push to build climate resilient health systems. So last year, the WHO launched the Climate Resilient Health Systems Initiative in May, and they are working with governments to try to build health systems that will be resilient to climate change. And they've also, I got lost in my notes there for a moment. Another partner of ours, Healthcare Without Harm, is sort of tackling both health systems resilience, but also looking when we build new health systems, when we repair health systems, as we build out the health sector, can we do it in a way that is both climate resilient, but is also low emission? So being aware of the ways that plastic is used, trying as much as possible to have health systems run on renewable energy, being thoughtful about where in space health systems are constructed. I know I've heard this more about the Pacific Islands than I have from hearing this from health workers in Africa, but I know there's as sea level is rising, people are having to be really cognizant of building health facilities on high ground. And I think that will likely be the case in many coastal areas. So recognizing climate change is coming, and as we build the health systems out, or we restructure, thinking about how to make them for a future where climate change is a reality is going to be really important. The other thing that we can do that is really makes for a climate resilient health system is having health workers who understand that climate change is a crisis, that climate change has health impacts. And so we're very fortunate to work with the International Federation of Medical Students, who are pushing to have climate change included in med school curricula so that the next generation of doctors knows that climate change is coming. But also this year we are trying to continue to offer webinars and educational opportunities so that the health workforce who's already in the field can gain that understanding. I think one of the reasons that's really important, again, somebody pointed this out during the regional consultation, but if the current health workforce doesn't know that, you know, malaria in this new region might be showing up in a place that it didn't show up before because the temperatures have changed, or that, you know, that if they're not aware that the climate change is potentially leading to that, they may not be prepared to respond. They may miss something. And so someone was noting that it's going to be really important to make sure frontline health workers are recognizing health impacts of climate change so that they can report back to policymakers and decision makers about what some of those impacts are, particularly when there's this lack of research about what the health impacts will be. That sort of like the chain, one part of the chain is making sure frontline workers are aware so they can help the health sector more broadly understand the impacts that exist and that may be coming, so that good policy can be made to protect health. So I think a key part of a resilient healthcare system are health workers who understand the ways that climate change will impact health. There's also, I think, going to be a need for a lot of advanced preparation for disaster response all around the world. This is a photo from the flooding in Malawi in 2017. And I think making sure that the health workers and the health sector are included in conversations about possible disaster response and also in all climate planning. So one of the things that one of the international mechanisms and things that happens is all countries are being asked to develop national adaptation plans for climate change. And the WHO has a set of guidelines for what possibly could be suggested in the health space. But I think as much as possible, as much as we can, ensuring that there are health leaders at the table when those national adaptation plans are being developed, that health leaders are in the room as disaster response plans are being made. I think that will be crucial to protecting health and addressing the health impacts of climate change, because you, health workers and the health sector more broadly, you really understand and have a crucial lens of what will be needed to protect people's health. So making sure that conversations are happening now about possible disasters that may come, and also that health workers are included in conversations about planning for those disasters. Sorry. Finally, I just wanted to close with a note about COP27. I don't know, very briefly, I'll give a definition of COP, because I'm not sure how much of this is a health crowd and how much of this is a climate crowd. But a COP is the Conference of the Parties. It's the meeting that happens every year with national leaders and negotiators to discuss what will be done about climate change. The last one was in Glasgow. And this coming year in November, it will be held in Sharm el Sheikh in Egypt, and is therefore broadly being called the African COP. I think one of the things that this will mean is we are already seeing a really strong push around the funding that I talked about. There's already a fund in place to help countries who need resources to mitigate climate change. So for example, by shutting down a coal plant and starting renewable energy in some way, or countries that need to adapt to climate change. Some funding is available through something called the Green Climate Fund. The way the Green Climate Fund works is polluting nations are required to put in a certain amount of money to this broad fund. And then various organizations and governments, I believe, can apply to access money for projects that either help to mitigate climate change or help countries adapt to climate change. There is no money right now for what is called loss and damage. So adaptation money would be like, we need to make sure this clinic we're building can be moved to safer ground and is ready to deal with a climate impact. Loss and damage funding would be, we've already had a flood, we need money to rebuild. Who is paying for that? And so I think what we are going to see this year is a lot of lobbying and push from the international community. Is this you giving me time? Okay, I'll wrap up. I know I'm almost done, I promise. There's going to be a big push from the international community for money for loss and damage, so that when disasters happen, there's an international bucket ready so countries can respond, because again, it is the fault of a global failure that we will be seeing these impacts. And then so I think there is going to be a lot of conversation about funding for addressing climate impacts this year. I also think it will be a really important moment to draw attention to health impacts in the African region, which is one of the reasons I'm so excited that this webinar is happening now. And a final note on what the Global Climate and Health Alliance is planning to do. We are going to continue, we're building on that healthy climate prescription letter and doing advocacy around that with global partners. We're hoping to host another virtual convening of folks in a couple of health workers in a couple of key regions, so the African region and the Eastern Mediterranean region, with the goal of just creating a space for people who are doing this work to come together and talk to each other and learn with each other. And we'll also be holding online events during COP and probably in the lead up to as well. And so we're excited to work with you, to partner with you, and to continue this conversation. So again, thank you so much for having me. If you're interested in learning more, that's the website for GCHA. And I'm just, really delighted to have been able to be here. Thanks so much.